Hey everyone, I'm Lauren Fleming, the founder of Him Supportwear, and today we have Dr. Jill Ingenito with us. She is a DO and she's a dedicated pelvic pain specialist committing to helping individuals reclaim their lives from the grips of pelvic pain and related disorders. She provides full scope OBGYN care, but her heart is with the pelvic pain community, especially people with endometriosis and pelvic floor dysfunctions. So Jill, we're so excited to have you here talking with us today.
Happy to. Thanks for inviting me.
I'd like to start off just with you telling us a little bit about your background and what inspired you to be in the role and have the focuses that you do now.
Sure. So I went into OBGYN kind of by accident. I was going to be a radiologist, and that just didn't seem to fit my personality. So it was kind of a last minute decision, but I went with OBGYN, and it is definitely different than I thought it was going to be, but still very rewarding. I have been in private practice for I was in private practice for 3 years, and then I went into more of a group setting practice for the last 10 years. So I've been out for about 13, 14 years. Um, where I am now is in a large city, and we serve a huge population in the metro area. And I initially was just doing general OBGYN, all the things, and I felt like there was just a really big need for pelvic pain care. Uh, Truthfully, not a lot of docs want to do it. It can be really challenging um, with chronic pain in general. So I think I felt like that was kind of the general sense in our group. And at the time, I was like, I need to do something to stimulate my brain. I need to learn something different, do something different, and like just get these people the help that they need in a more timely fashion.
Great. Yeah. Thank you for sharing that with us. Can
Yeah.
you talk to us a little bit about what your day-to-day looks like or kind of how your weeks may vary with the different roles that you play?
Yeah. My weeks are different every week. So it's a bit of a scheduling nightmare. However, it works. I work only about 3 or 4 days a week. I do some overnights. So I still deliver babies. And so I do some overnights. Typical week, I would say I'm in clinic one day, and then I'll have another day where I'm doing endometriosis surgery. And then I'll have another day where I may be at the hospital. And it varies kind of week to week, depending on what our group needs.
Great. I imagine it keeps you on your toes,
It
seeing
does.
where you are from day to day.
It does. And that's like one of the reasons why I went into OBGYN, because there's so many different areas that you can go into. Um, and so like you just take care of women throughout the gamut. So it just kind of does keep your mind stimulated, and whether at the hospital or in surgery or in clinic, all the things.
Sure. Can you talk to us a little bit about, thinking specifically about these areas you focus on with pelvic pain and then related disorders, pelvic floor disorders, things like that. If you're talking to somebody that's not familiar with it, maybe hasn't experienced anything or doesn't know that they are, what would you say to them about the importance of, learning about these conditions and then what that can kind of mean just for their like knowledge base?
Sure. So the majority of what I do is like endometriosis care and then pelvic floor disorders. So um, endometriosis is really common, and I think that it's gaining more notoriety, but really it's 1 in 10 women. So it affects
Yeah.
everyone. And sometimes I feel like people just walking around and don't even know it, which can happen. Um, the the importance of it is that the earlier we catch it, the earlier we get ahead of it, the less likely it is to destroy your internal organs. So you don't have to struggle with infertility and suffer and miss out on fun things in life. So I'm trying to raise awareness in that space, just because I find myself saying same thing every time. And I hear the patients say the same thing too. I wish I would have found you sooner. I wish I would have known about this.
Yeah.
Probably one of the most shocking things with going into the endometriosis space was how much of people or women's pain was actually coming from their pelvic floor. So I kind of always looked at it before that, oh, it's the endometriosis. But lo and behold, as people start to work through PT, they're like, no, 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 no. That's my pelvic floor pain, and this is my endo pain. Um, and the pelvic floor itself, you have to have it. It's essential for overall well-being and daily functioning. And some people just don't even know what it is.
Right.
Um, And that's probably one of the most shocking things to me is that like people have no idea what their pelvic floor is. They have no idea what's going on when they're coming in with prolapse. So it's just a very interesting thing. We all have one, and it's so integral for our bowel function, our bladder function, our sexuality, our core stability, our posture. And people are like, what's the pelvic floor?
Yeah, I
I didn't
know.
know it could go wrong. And it can go wrong in so many ways, right? Like the
Hmm.
more popular thing that people know about is the prolapse situation. And
Right.
I mean, I personally struggle with that. I've seen patients for years who struggle with that, and some of them it gets so severe that it does cause pain.
Hmm.
Um, and then there's kind of the other side of it where the pelvic floor can be just so tight and tense and tender that it's like
Right.
you're living in a constant like gripping muscle spasm. So yeah, just I'm trying to raise awareness about endometriosis, and then as the work has kind of progressed, it's kind of transformed into this more of like a pelvic floor
Hmm.
um, thing, and that really came from, to be honest, like learning from my patients, and they would be like, "Yeah, I went to the PT, and either all my pain is gone or 90% of it is gone, and I still have this 10%." So,
Right.
um, yeah, that's kind of that.
No, that's great. What, thinking about pelvic floor health and the lack of like awareness and knowledge, what do you feel like are some of the top misconceptions that you frequently come across regarding pelvic floor health?
Yeah. So it's getting better because I will see some women, a lot of women now, like who just had their baby, and like, I need to see a pelvic floor PT. I'm like, okay, great, we can do that. No, no worries.
Right.
Um, but um, I think it's kind of interesting because, right, most people think about it like you were pregnant and then like things are just falling out, right? And so the problem is like a lot of these people are just like coming off of like a major life change. Like they just had all these
Hmm.
kids, or you know what I mean? They're just like pregnant and
Right.
breastfeeding. You don't really have time to take care of yourself. And then you're in the stage of raising little kids, and then you're in the stage of like they're teenagers, and you're like, I don't know what's going on there. And you just kind of deal with it. You're like, oh, I can go jump on the trampoline, but I have to change my pants, or
Right.
all that kind of stuff. And you're just so, I think people are just really busy after they have all this pelvic floor trauma. And then it's like they just don't have time to
Yeah.
take care of it. Um, and so I think probably one of the biggest misconceptions that I see is that um the pelvic floor doesn't cause pain. And really the only issue that you can have is that your vagina is falling out or your bladder. So
Hmm.
I feel like I see a lot of people, who are like, well, I didn't know that this could be a problem. Do I just need to do more Kegels? And I'm like, no, you do not need to do more Kegels. Please stop doing Kegels because you're living in a Kegel.
Right.
So I think that's one of the biggest things is like people think it's all the prolapse, but the pelvic floor can be really tight and tender and they're just living in a Kegel. Um, I think one of the other biggest misconceptions I hear is, people come to see me for pelvic pain and they'll be sort of in the space of, again, they don't even know what pelvic floor is. They've never heard of it. They've been to the ER 3 million times and they've told them that, oh, your pain's coming from an ovarian cyst. Oh, you might have endometriosis, this and that. The ovaries lay on top of the pelvic floor, right? So it's like you
Hmm.
have the bowl, which is the pelvic floor, and then it's like two little peaches in the bowl and they're laying on it. And so a lot of times people say, I have this ovary pain. I have this. I'm like, could definitely be your
Hmm.
ovaries. And we can definitely check that out with imaging. At the same time, just be aware that your ovaries lay on top of your pelvic floor, and sometimes discriminating between what's muscular and what's ovarian is very challenging. And
Hmm.
I found the biggest thing to be helpful for people is as they work through PT, they're like, oh, right. Okay. That's my pelvic floor. So that's probably, you know, the two biggest things. And I think I already touched on the part about like, just if your pelvic floor isn't working, like you're going to be constipated. You can't poop, the peeing is an issue. Like you can't urinate. Sometimes you can't empty your bladder. Sometimes
Right.
the urine won't flow. Like it's just, and a lot of times people are like, oh, I have a UTI. I have interstitial cystitis. Maybe it's just like your pelvic floor doesn't work.
Right.
Right. But
Yeah.
like,
Yeah. It's like,
chronic
what's the root
constipation.
cause? Yeah. That's causing these other symptoms. And
So it's like, and I feel like, especially in medicine and with stuff down here, it's like we're so quick to go to like an organ, like, oh, it's got to be my colon. I'm having, and so it's like we're so quick to go to like a specific organ, but like no one goes, gosh, what else? And like
Interesting.
so many times I'm like, it's your pelvic floor. Like
Hmm.
you don't have IBS, you have
Right.
this issue with constipation because you just don't, your pelvic floor can't relax. So
Hmm.
those are
Yeah.
my big,
No, and those are three really big ones. And I think a lot of, to me, what I'm hearing is a lot of it stems back to just that foundational knowledge of like, what is the pelvic floor? How does it work? And then as you're trying to sift through these things, understanding how your pelvic floor can contribute to so many things, and then like what resources you have to help mitigate the symptoms that's being caused by the root cause of issues with your pelvic floor, whether it's laxity, tension, all those kinds of things. So yeah, and I do think we are seeing folks where that the general population's knowledge is increasing, but at the same time, there still is a lot of, a big hill to climb, I feel like, as far as people, knowing what kind of help to ask for, and then having providers like yourself who are really supportive, of that. Because I know I've also heard stories where people will ask for a referral to pelvic floor PT, and they get varying reasons as far as why that may not be a good fit for them. And so it's great when there's folks like you who are, knowledgeable, and then like, yes, let's get you connected and see what it can do for you. And then that can help rule something out or potentially help, solve it or be a good contributor. So
yeah.
yeah, it's interesting to kind of hear how it all weaves together.
Yeah. And I think it's kind of, I mean, I always like, say, I wish they would teach about pelvic floor and sex ed, but at that time in your life, you're like, what is happening?
Right.
Um, and then there's like not another great opportunity. Like I feel like that's where it happens. And people aren't talking about their pelvic floor on the dinner table unless you live at my house.
No.
But uh,
Right.
and then it's like the pregnancy. Like I think there's a great opportunity during
Yes.
pregnancy to introduce like here's what it is. And if we had everybody do like third trimester pelvic floor PT,
Yeah.
even just like a one or two touches with the PT, that would be so helpful.
Hmm.
And then, just raising awareness, like this is what can happen after your delivery.
Yep.
If this is you, here's what you got. Just know that there's options out there. You don't have to like just deal with this for 10
Yeah, I
years.
think, yeah, making it part of that standard of care, I think would be a huge leap as far as making this better, for folks, for sure.
Yeah.
Can you share a success story where pelvic floor physical therapy has helped one of your patients?
I mean, it's life changing for these pelvic pain patients. There's not just one. I think probably some of the biggest success stories that I like really, you know, remember are some of my like early endometriosis patients. And so in the beginning, I would see these women who have had like just insane amounts of surgery. Like their surgical history would be like 7 or 8 different surgeries for pelvic pain.
Wow.
Okay. And so invariably over the course of all this time, they've had everything removed, right? Uterus, cervix, ovaries, fallopian tubes. Then someone goes back in and tries to clean it out and they're still in pain. And so you're like, and then you talk to these women and they're like, well, I didn't even know I had a pelvic floor. I'm like, oh wow, okay. They're suffering in chronic pain. They've had
Right.
1,000 surgeries for endo, and then they've never done pelvic floor PT. And they'll go and they'll be like, I have been in pain for 25 years.
Wow.
No one could tell me why. I went to pelvic floor PT and it literally changed my life. I mean,
Yeah, that's incredible.
yeah. So I just like for those women who have had so many surgeries and so much chronic pain from their endo and every single organ's been removed and all of their, you know, hurts have been taken out. And not that that was the wrong choice for them at the time, but like
Mhm.
they are still having pain after all of that. And I'm like, wow, you just probably needed pelvic floor PT about 25 years ago.
Yeah,
So
that's incredible.
minimizing, like when I see that, minimizing the number of surgeries and that kind of life-changing effect, it's really remarkable. And I've seen actually, quite a few teenagers that's the other area is like I've seen quite a few teenagers who either have endo or don't, but they have just a ton of anxiety and stress, and they may have been through trauma in their life, and so many
Mm.
people have. And I think for them, just kind of recognizing, their trauma and then knowing that in their body that the trauma, either physical, sexual, domestic violence, just a really disruptive home or not living in a home or whatever it was, that they're holding all of their trauma in their pelvic floor, right? And
Mhm.
so they are in chronic pain every day because everything's so tight and tense, and then they start to do PT and their life changes, right? And then they kind of feel like, okay, now I'm going through the PT, I can kind of work through what's happened to me in the past with various therapies, and they get better, right? They're able to have a relationship. Now they can have
Mhm.
sex. You know what I mean? Like whereas before they're like,
Right,
not happening.
right.
So those
Yeah,
are kind
that's
of
amazing.
two.
No, that's great. And that really kind of leads me to my next question too, which is, thinking about, okay, pelvic floor physical therapy and how it can help someone like a teenager. Can you touch a little, and I know a lot of people think of it for pregnancy and postpartum. Can you touch a little bit about like over the course of a woman's life, how it can play a role, over the whole lifespan?
The PT.
Hmm.
Okay. So, I mean, teenagers are not, they're like, we're not going to, you know what I mean? Unless they're really struggling,
Sure, of
they're not
course.
going to PT.
No.
You have other things going on. And even like some college age kids. But I think kind of as you move out of, that kind of educational space and move into like the real world, whatever that is, um, and kind of, you're kind of more established in relationships and that kind of thing. I think that's really where it can play a role. I do think probably the most obvious intro though is the pregnancy
Mhm.
time. And I wish there was also a way to reach women who've had, sexual trauma at a young age, like, or physical, whatever it is.
Mhm.
But starting PT in pregnancy is really kind of, I would say we should move to standard of care for that. That's like one of the best things that you can do during your pregnancy. Um, and then from there, it should be, rehabilitation should start right after pregnancy. And then going forward, any issues with urinary incontinence or pelvic pain that you should really continue to do PT. Um, so yeah, I mean, I do my teeny, like, I think they just have other things going on, but my
Yeah, of
teenage,
course.
like if they're coming to see me and they're missing school and work and they can't have sex or they can't do whatever they want and they can't, do gymnastics or ballet, they can't do the
Mhm.
fun things that they want to do because they're always in pain, then that's a place to introduce it there. But again, it kind of goes back to like, I wish we could teach about it in sex ed, but
Yeah. Yeah, and just start that foundational knowledge early on.
yeah,
Absolutely. Can you share with us what some of the most rewarding aspects of your work?
sure. I definitely think I've, shared a couple of those already, those patients who've been like struggling for years and
For
then look
sure.
back 25 years, you're like, oh my gosh. Um, obviously like the pregnancy and the delivery. That's such a special time for people. I think I just every time I'm involved with like a delivery or a C-section or whatever, I just feel like that's such a remarkable moment for these
It is.
people. And it's
Yeah.
special because like I get to be a part of it, but I also try to be like in the background, like this is about me, it's about you, your family. So I kind of try to be just like a little person in the corner, letting them have their moment. But it's just cool to see people like go through that because there's so many emotions, and I just like learned a lot about the human experience through that and how different people and different families, how that happens for them. Um, but I mean, I think on a day to day, I'll have people who come back after their endometriosis surgery and after starting pelvic floor PT, and they're like, I'm better. Like, I wish I would have found you sooner.
Yeah.
So that's really, really rewarding because they come in and they're crying. I'm just like, I've seen a million doctors. Like, it took me forever to get here. I'm like,
Yeah.
so those are the good moments. And, that's one of the reasons I went into it is like I had somebody who came back to me and was like this. And I'm like, wow, this is like as life changing for this woman as like when somebody has a baby. I just felt
Yeah.
like that same emotional sense, like, wow, I just literally changed one person's life,
Hmm. Yeah. Like a huge transformation as far as their day to
Yeah,
day.
they
Yeah.
can live their
Hmm.
life. They don't have to miss on school and work
Yeah.
and fun activities. They can have relationships. They can have sex, like, things that they just want to do.
Right. Yeah. Thank you so much for sharing that.
Sure.
I have one more question for you, which is what is one thing that you wish that everybody, like if someone was hesitant to seek help, they're suffering and they, for various reasons, might be hesitant. What is some advice that you would share if you were talking to that person?
Yeah, so I do see that a lot in the prolapse, like in the people who are struggling with incontinence. I do see that a lot. Like that's like a really common thing. And so it's just interesting because like, right, like I had prolapse and urinary incontinence and I've had 2 vaginal deliveries. And like, if I don't wear my pessary to yoga, like my yoga pants are gonna look like I peed my pants, which to be honest, I don't really care, but I'm also
Mhm.
comfortable with like all bodily fluids. So it's always interesting. I'm just like, everybody pees their pants. I don't know why, so I try not to take that stance, to be honest. I try to be more empathetic and encouraging. I really try to break it down with those like diagrams and anatomy. I'm like, hey, listen,
Mhm.
your bladder's right here. It shares an apartment wall with your vagina. Okay. And like just kind of educating, like these guys are
Yeah.
neighbors, right? And so when your bladder gets full and the weakest point in your body is your vagina, it's just all going to cave in, right? So I try to break it down really, really simple. I do try to normalize it. Some people like that, some people don't.
Mhm.
Um, but I mean, it is unbelievably common. And when people say they're not peeing their pants, I actually just don't like I just don't necessarily believe them. Um, because you do a pelvic exam and they cough and they're like leaking urine when they cough,
Mhm.
and you're like, okay.
Yeah.
Um, So yeah, I mean, I try to normalize it, try to bring it down. And then a lot of times, sometimes when you deliver the information to people, like they're just not in a space where they want to hear it. And I really,
Mhm.
that's like one of the biggest things I've learned from like the incontinence work and the prolapse work is like, okay, hey, this is what's going on. Like your whole inside isn't falling out. And yes, you're leaking urine, but is it bothering you? Is it disrupting your life?
Mhm.
Well, and then that's a personal decision. They have to decide like
Right.
what level of what they're willing to deal with. I'm like, I can't answer this question for you.
Yep.
You
Yeah, and
need to
that's gonna
decide.
vary, yeah, from person to person. Yeah.
It's different, and it is different every time for people that have like severe prolapse. And I'm like, you need to do something about this.
Yeah.
And they'll be like, "No, I'm good." And then other people have very minor prolapse, and they're like, this is so
Yeah.
destructive. Like
Right.
people like haven't had kids, and they're like
Mhm.
leaking in yoga or something like that, and you're like, okay, yes, like let's get you in for some PT, consider a pessary and all of this. So I just always tell people like schedule one appointment, find out what your options are, and then go home and either do nothing about it.
Right.
You know about it, then you can
Yeah.
always come back. And I would say like more than 50% of people eventually come back a year or two and they're like,
Mhm.
okay, I'm gonna need some help because now it's really bothering me.
Mhm.
Um, Now, I've had my second kid and I can't jump on the trampoline at all, or I can't go running, or like, you know, I always have to wear a pad because I'm leaking and it's irritating my
Right.
vulva. My skin is so irritated. Like, look at this, and they'll have all these
Right.
horrible skin conditions down there. And you're like,
Right.
is this because you're wearing a pad every day?
Mhm.
And your skin is so irritated and the pad is being worn because it's just like there for
Right.
leaking urine. So
Right.
I see that quite actually commonly. And like, yeah, but I'm
Yeah.
just gonna wear a pad. I'm like, that's fine, but
Right.
your skin is telling us otherwise. But so
Yeah.
come back.
Yeah. When I think that like that advice of having, the one visit to understand your options, I think is really and taking the pressure off of having to make a decision, I think
Yeah,
can be helpful. Cause I feel like some people might feel like, oh, if I go in and my doctor tells me something, I have to do one of those choices. And it's like you can go on fact-finding missions and make no decisions. And like you said, take your time and at least know what the options are. And then as things change or as, it bothers you more, at least know what those different paths can be and kind of like try the different ones on too. Like, because I know like for some people, when you start off on your journey, what may feel like I'll never do that, later on, you're like, well, I'll consider that, because you learn more or you hear different experiences or your symptoms change and you're looking for different solutions. So I think the fact finding is super helpful.
yeah. And
Yeah.
it's so I actually have your posters like up in the exam room, the hem, right? And so
Hmm.
it's actually a conversation starter because people are like, hey, what's
What's
that?
that?
And then, oh, I think I might need that. You know what I mean? Or they're there for
Yep.
some other reason. Like they're just coming to
Yeah.
get their, they're coming to
Sure.
tap, they're coming to get a breast exam, whatever it is.
Yep.
And like, What's that?"
Hmm.
Like, that's for this. And then they'll be like, oh, yeah, I have that. Do you think I should try that? Yeah, give it a try. If it
Right.
doesn't work, come back and see me, we can talk
Right.
about, you know, what are some other things you can do besides support wear? Do you want to try a pessary, pelvic floor PT?
Yep.
Like, are you considering
Yeah,
surgery?
and I like having, yeah, having all of them, because like myself personally, it's like I have the garment, I use a pessary, I still do pelvic floor PT. It's like having multiple options is so nice, because as things change, you can rely on them for different reasons at different times.
Yeah. I actually
Yeah.
thought about at one point, like, because every time I bring a pessary up to somebody, they're like, what is that? I'm like, these are so common. Like,
Yes.
so many people have them, and so many people have no clue and they've never heard about it, right?
Mm-hmm.
It's actually remarkable. But I thought at one point of like taking like the sample pessaries and like stringing them together, like in a little like bunting banner and putting
Yep.
it in the exam rooms. Anyways, not everybody agreed with that, but I was like,
I think it'd be great. I know there is a stigma around
great.
this too, even for people who know about them. And you're like, guys, this can be a game changer.
Yeah. You know, and
Yeah,
not like, oh my God, I'm gonna need surgery. I'm like, no, you could just try one of these that's hanging on the wall.
exactly. Yeah. Which one would you like?
Yeah.
Great. Well, thanks so much. Is there anything else, parting thoughts you'd like to leave us with before we wrap up?
Um, no, I think I really love the awareness that you're bringing to this space and just like giving people options. And actually, I think that this is a great starting point for people because, you know, they can just like, they can go home and they can buy the underwear and they can try it and
Yeah.
they can see like what's the support garment is and like how it helps. And then
Hmm.
they can maybe take the next steps if they need to. So I
Hmm.
think, you know, this is like a nice baby step.
Yep.
Um, when they're like, I don't have time to do PT, you're not putting
Hmm.
anything inside me, and I'm definitely not having surgery. Okay,
Right. Yeah.
great.
Start here.
Yeah, I mean, everyone has to wear underwear, so like maybe just give
Right.
this one, the support garment a try and see. And then if you, yeah, if you want to talk about it more, come back and see me.
Yeah. Great. Well, thank you so much, Jill. We really appreciate your time. And we
You're
thank you so much
welcome.
for talking with us.
Yeah.